At the Vietnamese Seventh-day Adventist Church in San Diego's Fairmont Park neighborhood, a health fair is underway. People are offered screenings for diabetes and blood pressure. They can consult with a doctor. But the event's main focus is hepatitis B. That's because while Asians make up less than 5% of the population in the U.S., they account for more than half of all hepatitis B cases. About 1 out of 12 Asians has the virus. Even so, and despite the fact that the disease is treatable, awareness in the community is low. Dr. Bin Tran, founder of the Asian Pacific Health Foundation, says there are some cultural barriers to overcome.
People do not want to know that they have the hepatitis B because it has some stigma to it. And sometimes in the culture from here, we don't talk about our diseases in public. So, and the language barriers, sometimes when you go and they cannot be understood.
UC San Diego pharmacy students take turns talking to the crowd about hepatitis B.
Someone, you can't get it by physical contact. It's mostly by bodily fluids, blood to blood transfer.
Những cái đường mà không có gây bệnh đó là
Fourth-year student Sandy Chong is one of the event organizers. She says this kind of outreach to the Asian community is crucial.
They may not be that familiar with all the background, such as transmission, what are some treatment available, how they can prevent it, but they are very interested in learning more about it. So that's why we're trying to get another effort of educational purposes here so that we can educate more people and let them know where they can go to get more information.
Hepatitis B is a liver disease. It's often transmitted from infected mothers to infants at birth. It can also be spread through unprotected sex or contact with contaminated blood. The virus is treatable. It can be prevented through a series of 3 injections, usually given in childhood. But access to the vaccine has been limited in some parts of the world. More than 400 million people are infected worldwide. The World Health Organization recently held a session on hepatitis B at its annual meeting in Geneva, Switzerland. Dr. Giseo Greco directs AIDS and viral hepatitis programs for the government of Brazil. He says the disease can lie undetected in the body for decades.
In a way, it looks like HIV. It may stay for a long time without any symptoms, and when we finally diagnose it because of symptoms, usually it's very late.
Hepatitis B can cause liver cancer and cirrhosis. The disease is linked to more than 1 million deaths a year. Even so, the patient-driven group called the World Hepatitis Alliance complains the disease doesn't get a lot of attention.
It's actually inexplicable that it has such a low priority. And so we're really committed to try and change that.
Charles Gore says people need to know that hepatitis B can be treated. But he says the first step is finding out whether someone is infected.
That's a critical issue. This is probably the biggest problem we face at the moment, is trying to reach the undiagnosed and get them to get tested.
That's what the health fair at the San Diego Church is all about. All of the people here who get tested for hepatitis B will get their results mailed to them in a week. Those who test positive will get a phone call and information on where to go to get care. UC San Diego liver specialist Robert Gish explains the disease can be treated by taking a pill once a day.
The chance of controlling the infection and clearing the blood of the infectious virus is over 95%. Now, it's not a cure. We don't have a cure for hepatitis B yet, but we're going that direction, and this is at least a way to suppress and control, change how the patient's outcome is, change their infectivity. So it's very effective therapy, and it's very safe.
So far this year, the team from UC San Diego has organized 12 community health fairs. All told, they've screened more than 500 people for hepatitis B. Kenny Goldberg, KPBS News.